Well, thank you all for having us. My name's Cara Glover, and I'm Associate Medical Director at AstraZeneca. I'm supporting our breast cancer franchise, and I'm so excited to be here today with you, Dr. Gore.
Thank you.
Yes, so we want to just be real and have an honest conversation in regards to breast cancer. And let's start off with just a quick question. How many of you, if you could just put your hands up, have you been affected by breast cancer? Now keep your hands up. How many of you know someone who's been affected by breast cancer? I want you to take a look around. That's about everybody in here. So this talk is for you.
All right, let's go.
Let's get into it. So, something that's always hitting home or just questions that always come up is about risks and symptoms. So what are some signs and symptoms of breast cancer? What are some that, we don't normally think of that happen?
So, one thing I want to say, especially for those who are getting screened regularly, for most women, you're not going to feel anything. That's the whole point of a mammogram. But if you do, the first one is usually a lump. A woman will say, I felt this knot in my breast. I felt this knot underneath my arm. Underneath the arm, that's where your lymph nodes are. And so if it's there, you're probably already stage 2 at least. If it's cancer, there are other things that can cause lumps underneath the arm. So that is something to be mindful of. Other signs that we don't think about, any new rashes, peeling, dryness, crusting, especially of the areola and nipple, you need to be worried and you need to get checked. Redness of the skin, especially if you're not a woman who you don't have any bug bites, you haven't been out in the woods, you're not breastfeeding, because that's one thing that can cause redness of the breast, that's mastitis. But if these things are happening and you haven't been bitten, you're not breastfeeding, you haven't breastfed in years, that's something to be worried about. Now, it's also important to remember that the way a rash looks on somebody who's fair skinned is very different than what it looks like on somebody who's a darker hue. And so be mindful of the fact that red may not be red. Red may be burgundy or a darker brown or something like that. Any swelling of the breast should be a cause of concern, especially if one breast is larger than the other. Then seek attention, okay? Because it could be cancer. Um, Another one that people don't think about, if the breast develops this thickening of the skin, this orange peel appearance or feel, that can be an early sign of breast cancer as well. And so it won't always present as a lump.
Thank you for that. And I think something that comes up often is some people have breast cancer that runs through their family, and some people don't still have breast cancer. So is breast cancer hereditary? What's the take on that?
Some of them are. This is a great question, a very common question. So, one thing to note, the overwhelming majority of people who get a breast cancer diagnosis, they do not have a family history. 75 to 80% of people, this is new. You may be the first one in your family to develop it. Okay. But there are some of those who it runs in the family. If this is the case, especially in a first or second degree relative, your mom, a sister, your aunt, it could be genetic. And so in those cases, I tell patients, you may want to get genetic testing to figure out if this is a risk. And if so, there are things that we can do, including increasing your screenings every year, sometimes a prophylactic surgery or a risk reducing surgery so that you don't develop cancer.
Absolutely. And kind of bouncing off of that, what are some genetic risk factors? I think you just mentioned a few, but what are some things that people should be looking at or looking for to say, oh, this is going to increase my risk of getting breast cancer?
So if you just have a lot of cancers in your family, and there are some families like that, I know a family where literally every single person in the family has gotten cancer. In those cases, get genetic testing ASAP before it even happens to you so that you can see what you need to do. Other risk factors that aren't necessarily breast cancer, if there's prostate cancer in your family, sometimes colon cancer, there are some syndromes that are linked to breast cancer also. Um, Ovarian cancer, that's a big one. If there's ovarian cancer in your family, I would give genetic counseling. Also, if there are any men in the family with breast cancer, that means you're a high risk family and other members of the family should get breast cancer. I mean, should get genetic testing. And I know we're going to talk about it, but I think it's extremely important to say this out loud. Men, this is for you too. Men get breast cancer. Richard Roundtree, Shaft, he had breast cancer. Matthew Knowles, Beyonce's father, he had breast cancer. And so this happens to you, not at the same level as women. 300,000 cases almost of breast cancer will be diagnosed this year. Men make up about 1% of those cases. So roughly 3,000 men in the United States this year will get breast cancer. And I have quite a few men who are my patients. So be mindful of that. And so while we're telling women, examine yourself, know what your body feels like, men, you do the same thing. If you feel alone, go go get evaluation immediately.
Right. I think that's super important. I mean, I feel like that's a common misconception that it's always in women, but also men.
Don't have as much breast tissue, but it's there.
Yes.
So they, they should absolutely check themselves also.
So how can I find out about my biomarker status? What is a biomarker, number one? And then how, what does that mean? What's its importance to someone who is, trying to figure out whether or not they have breast cancer?
So, so it's important to say that the biomarkers, these are receptors on the cancer. And so nobody's checking these if you don't have a cancer diagnosis. But if you do have a breast cancer diagnosis, when they're telling you about the type of cancer it is, they're also looking at three things. They want to know, does this tumor express the female hormones, estrogen and progesterone? And does it express a third receptor called the HER2 receptor? If all of these are negative, that's what a triple negative breast cancer is. So you might have heard that term before. That means it doesn't express those three hormones, estrogen, progesterone, and HER2. These are considered particularly aggressive because there's less medication to target it. And unfortunately, this is the most common breast cancer that Black women get diagnosed with. But what's most important is if estrogen is positive, if HER2 is positive, that means we have medications that we can give you even after surgery, if you need radiation, after radiation, to minimize your risk of breast cancer happening again.
I think, there's been a lot of chatter over the past couple weeks of guidelines and when to get tested or when to start getting screened. So let's talk about it. Like, when should I start? How should I start? What can I do? Let's maybe put it by age. So you're in your 20s, if you're in your 30s, if you're in your 40s, what should I be doing to make sure I'm advocating for myself and knowing my body?
So the screening guidelines are irritating because the main one that people use, the United States Preventive Services Task Force, the recommendations that come out from the government, um, they've been kind of behind the ball for a long time, and their recommendations aren't the recommendations that I use or other oncologists use. They finally changed it. Before they were saying women should start their screening mammograms at 50 and get them done every other year. Well, guess what? That doesn't work, especially when Black women are getting diagnosed at high levels under the age of 40. Most organizations recommend you start at 40, and this is something you get done every single year. I've seen people have a normal mammogram in March and then they turn up in May with a new cancer. So this is important. This is something that needs to happen every single year. It's covered by insurance. If there is no insurance, most departments of health do have a women's program where at least mammograms and pap smears are covered. And so this is something that needs to happen. The new recommendation, I think after a lot of chatter from the United States Task Force, is that start at 40 and get it done every other year. I'm telling you, you're every year, okay? Every single year, that's what needs to happen. A recommendation that came out in 2018 because of the fact that we're more likely to be diagnosed under the age of 40, unfortunately, is that Black women and Hispanic women should start having these conversations with their physician at the age of 30, and that strong consideration should be given to starting your mammograms at the age of 35 because we're more likely to be diagnosed at a young age. My youngest patient that I've treated, she was 19 when I diagnosed her. And so this is why being mindful of these things is important, especially on the physician side, you know, and having people who are cognizant of that. So that's my recommendation. In your 20s, know what your body feels like. Do self-examination. Some people don't believe that they work, but they do. I've had a lot of patients who have found their own tumors. So in your 20s, start examining yourself every single month. Pick the same time every single month, so that you know how they feel. And if something abnormal pops up, you can get it taken care of or get it evaluated. In your 30s, start having your clinical breast exams with your OB-GYN or PCP or whoever, and strongly consider, if you're in your 30s, starting your mammograms. And by the time you hit 40, this is something that you should be doing every year.
You know, something that I didn't bring up earlier is about dense breast. And this, I feel like, happens a lot more with our community. What should we be doing? Because it's not only just mammograms, but what else should we be doing to make sure we're seeing the whole breast?
Yeah. So dense breast tissue, and this is especially in young women, you have more glandular tissue than you do fat in the breast. So it just makes it really hard to see everything on an imaging study. Um, the breasts are very painful, especially during your cycle. And on top of a mammogram, I'm a strong proponent of the 3D mammogram. It's almost like a CT scan for the breast. And so more images than the regular mammogram. We'll also probably need an ultrasound, to look for anything that might have been missed on the mammogram because of that dense tissue. Now, one thing I do tell people, an ultrasound is not a substitute for a mammogram because they look at different things. So I know mammograms can be painful. They suck. I've been through it. I know it sucks, but it doesn't replace ultrasound. Doesn't replace the mammogram. And sometimes we'll get an MRI on women with dense breast tissue also.
Thank you so much. I think maybe we could do like a knowledge check of some of those really great things. So do men get breast cancer? When should you start getting your yearly mammograms?
Trick question. It was a
Trick question. That was like
Yeah, and yeah, thank you. Because with this family, with the family history thing, and especially with genetics, you're gonna start your screening way before 40. If you get genetic testing and God forbid it says you have a BRCA mutation, for example, that's the one that's most commonly associated with breast and ovarian. If that's positive, in your 20s, you're starting with an MRI every year. And then when you hit 30, you're getting a mammogram and an MRI every year. So that was kind of a trick question. But for the average risk Black woman, if you haven't started, I would consider starting at 35.
absolutely. We want to open the floor to any questions before we end.
First, let me just say hello, everyone. So, I'm a breast cancer survivor, diagnosed in 2016. However, one of the things that we were always taught, like you said, is to do your own self breast exams in the shower or wherever and feel for lumps. But mine didn't come from any of that. And it came from something that I had no clue was a sign of having breast cancer. Because we, as women, we sometimes lactate from our breasts. So I noticed that in my bra on one side, there was always a crusted um, residue, but I didn't know what it ever came from. So I happened to be at the gynecologist one day, and I asked her about it. So she did some tests on it, and she still never said anything to me because, again, um, I was clueless. We always was taught that feel for lumps, but it doesn't always come from lumps. It comes from residue, secretion from your breast, and that's how I found out that I had breast cancer. But I said that to say too, there was never a history in my family at all of breast cancer. I was the first. And at the same time, I work for North Methodist Medical Center, and I talk to a lot of women who are either going through or have been recently diagnosed from our Frederick B. Cohen Cancer Center, and just people I know in general. And I just want to say to everybody here, if you know somebody, even younger, I know the problem is that when they say you should have, I think the age is now 40, correct, to get a mammo, but I see women younger and younger and younger developing these issues. And when they go to the doctor, they will not give them a mammo because of their age, and or either your insurance won't pay for it. But there are resources out here that can that will pay for that for you. So if you know when we do have a table out here, my breast navigator is here and she's out there. So if you know if someone visit her, get her information because we don't want anybody to go through not knowing. Knowledge is power. So you need to understand your body and understand the resources that are out here to help you and to assist you in getting the help and care that you need. I could go on all day about this, and I know a lot of stories because, like I said, I talk to a lot of people. So, yes, just be mindful and be vigilant of your body, and it's not just feeling for lumps.
Thank you for that. And I did not mention that when we were talking about other signs and symptoms of breast cancer, but she's absolutely on the money with that. So any kind of abnormal nipple discharge, especially if it comes from one side and not both breasts, that's of concern, and especially if it's bloody nipple discharge.
Hi, I have kind of like a question, but you had mentioned it about dense tissue because that's my situation. And they say you should have the 3D. Is there a situation whereas the health insurance won't pay for that? Because I noticed you mentioned also that mostly the younger population, they have it. I'm in my 60s and I do have the dense tissue and my doctor always sent me for the regular mammogram. Is it because the insurance won't pay for the 3D?
No, I don't think so. And I did my fellowship in Brooklyn at Maimonides, so I had a lot of patients from Jersey also, and they always covered the 3D mammogram. These insurance companies are goons though. Like they pick and choose every other day what they will or won't pay for. But you should not have an issue with the 3D.
Okay, 'cause when I did ask, when I went for my mammogram, I asked them if they could do that. They said, well, your doctor has to refer you, but she never do. So,
Well, you can always get a second opinion and get another doctor.
okay,
Advocate for yourself. Advocate for yourself. If you don't feel heard, if you don't feel listened to, if you don't, I'm a huge proponent. I tell patients all the time, like if you don't feel like you're getting what you need, if you don't feel like it's a comfortable relationship, if you feel like you're being rushed out the exam room, they standing at the door with their hand on the door as soon as they walk in. Like it is okay to get a second opinion and to get another physician so that you feel comfortable participating in your healthcare. And that's one thing we don't talk about a lot is advocacy and advocating for yourself. This is breast cancer, especially if you're going through it, is a long journey. It can be treatments can be up to a year and a half. So you need to be very comfortable with your team.
Mike, that's big now. But I want to ask this question because I hear this all the time, that when you get in your 70s or your 80s, you don't have to, per se, get a mammogram. Is that true?
Good question. So what they tell us and how we're trained, they say if a patient has an life expectancy of 10 years or less, then you should probably stop doing mammograms. I personally don't believe that. I think it's all about a patient's quality of life and what they want to do. And so if a patient says, if I get this diagnosis, do I want it to be treated? Am I going to do something about it? And the answer is yes. Then you do what that patient wants to do so that they can continue to protect their health. So for some people, even if they only have 5 years left, they want to enjoy that 5 years to the fullest. And so I personally don't agree with stopping, having a hard cutoff at 70, 75 or whatever. I've had patients in their 90s who are way healthier than some people in their 40s and 50s who get treatment and they do amazing. And so whatever works for the patient, and it's not my job to dictate that.
Thank you for all that you do. I'm just curious, can you do the bracket test without having any issues? Just want to know, like how they do prevention.
Yeah.
Free of it in the family, but just curious.
Yes. You can do genetic testing whenever you want. Depending on the company, there may be a nominal fee, but so many of these companies also have programs for people so that they can get genetic testing done. Another thing to note for people with a breast cancer diagnosis, the recommendation is that all people with a breast cancer diagnosis get genetic testing. And so that's something to know if you're ever in that situation. But yes, I totally believe in prevention. And I think that it's something that if you can manage to do it, it's important to know before a diagnosis ever even pops up. And this is important too for people. Some people don't know their family history. Maybe you were adopted, maybe all of your family is gone for whatever reason. In those cases too, I always recommend genetic testing just so you can kind of get a sense of what your health risks are. Thank you.
I know before we wrapped up, I think that's something exactly important. I know we were talking about it earlier about those Thanksgiving talks, and that's the only time that, at least in my family, that we're sitting around talking about what's happening with Jimmy, Uncle Jimmy. Now he's sick. So, how can we do better as a community to, share what's going on with ourselves and continue to advocate for ourselves in the doctor's room, doctor's office?
Talk to your family. Don't surprise me at Thanksgiving. This happened before. Like, that's not the discussion I want to have around some turkey and dressing and mac and cheese. Like, don't do it. Like, don't mess up Thanksgiving. We're trying to get lit. So just, just please don't. So communicate with your family and ask the questions. And sometimes people don't want to share because they don't know how the family is going to take it or they don't want to hurt somebody's feelings. But while you're taking care of yourself and treating yourself, you're potentially saving your family too. And so just don't be afraid to begin to have the conversation. It's not something that should be done in private. I think that it also allows your family to support you if they know what's going on. And it helps the younger generations to also know what they need to be mindful of and what ran in their family.
Absolutely. And so if you were talking to your sister and you said, if you go into the doctor's office, you should ask these 5 questions. What are the top 5 questions would you say that she needs to ask?
In general or related to breast
And related to breast cancer.
cancer? I want to know, based on my age, what should I be doing right now? How should I take care of myself at home, and what kind of how do I examine myself is something I would ask. If I feel something, who do I get in touch with? Do I call my primary care physician? Do I need to go directly to a breast surgeon? If I get a diagnosis, what is a breast cancer diagnosis? What is my next step and what does treatment look like? And then another one that comes up is covered by insurance. And if I decide that I want to remove both breasts, is that something I can do? So who's a good plastic surgeon?
And I think that's also a common misconception is whether or not it's covered by insurance if you have to go get reconstruction. Can you talk about a little bit about that?
Reconstruction is covered by insurance. I think that this is so common. If you don't want reconstruction, there are some people who were like, I'm tired of them anyway. I want to be flat. Like, don't reconstruct me. That's fine. And there's a whole movement around that. But for those who say, I know it's an early cancer, but I can't bear the thought of going through this again. Can we just remove both breasts and can I get reconstruction? Absolutely, and it is covered by insurance. It's the Women's Health Act of 1998. This is not cosmetic. It is not considered cosmetic, and it is illegal for insurance to deny you the right to get breast reconstruction. Or if you decide you're not going to get surgery, but you want a prosthesis, it is covered by insurance.
That's important to know. Don't if you're going in with the mindset that it's going to cost so much, but then you end up finding out that it's free, maybe that changes your decisions or impacts your treatment decision making.
Anything else? Any last minute questions before we leave the stage?
Hey, Dr. Carter,
Good morning.
what's the difference between a cyst and a cyst? Really? Like cancer? Can cyst turn into cancer?
That's a great question, and it's a very common question. The cyst is literally it's like a fluid-filled bubble. And so usually some women get very painful cysts, especially leading up to their periods. If that's the case and they're really big, I literally just stick a needle in it, remove the fluid, and then the cyst is gone. Cysts are not cancer. Cysts do not turn into cancer. But if you have fibrocystic breast disease where you're prone to getting cysts, intense breast pain, I do watch those patients pretty closely, and they usually almost always get ultrasounds, even if they are too young to get mammograms, just to follow them closely. Great question.
Ultrasound, how long?
Excuse me, can you repeat?
Ultrasound, how long? To take it out of that. The first time. Second time, how long you take it out of that? Yeah,
Between mammograms?
yeah.
Every year,
They told me 5 years.
not for a mammogram,
Yes.
not for a mammogram, every single year, every year.
Wow.
I think someone said it earlier, right? So knowledge is power. Now she can go back and talk to her doctor and say, hold up, wait a minute.
A whole lot can happen in 5 years. Absolutely not. No, every year.
Yes.
Good morning, Dr. Gore. So my mother was diagnosed, African American woman diagnosed with breast cancer when she was 34 years old. And she fought until she was 40. And so as her daughter, I was prompted to take a BRCA test to know my genetic makeup. And that was probably about 20 years ago. Should I be retested?
Yes, the genetic tests that existed 10 years ago, let alone 20, are so different, and the panels are much larger and look at a bigger cadre of genes that we know contribute to breast cancer risk. 20 years ago, it only looked at BRCA1 and BRCA2. And so I would absolutely repeat it.
Thank you.
You're welcome.
Okay, so I have a question. You know how cysts and abscess are two different things? If you're constantly prone to getting skin abscess, are you at a higher risk of cancer, or is it like?
No, no. But you should they'll probably put you on antibiotics if they haven't put you on antibiotics, and then recommend different things for cleansing the skin, disinfectant type of things to minimize the risk of infection.
Thank you.
You're welcome.
We're so thankful to be here. And thank you
Yes.
again, Dr. Gore.
Thanks for having me. I'll be floating around if any other questions pop up, but thank you. Get your mammogram and be safe out here.